And so we're going to be here fighting for health care, and we're also going to be here fighting to reopen the government. Around 24 million people are going to get letters anytime from now until mid-November. And they are going to pay. Now, 24 million Americans are going to be told that because of the last tax bill that was just enacted by Trump and the Republicans, that people are going to be paying an average of 114% more per person per month. So it's not like we just went into a lab and cooked up an issue to try to hijack some unrelated moving legislative vehicle. The reason for this is that 24 million Americans are specifically on the ACA exchange, and they're absolutely going to get hosed. And because we're all in the same risk pool, it's not just people on the ACA exchange that are going to see massive increases in their health care premiums. Almost every American is about to see a spike in their health care premiums, just like they've seen electricity rates going up at double the rate of inflation, just like they've seen the price of vegetables go up by 39%, just like they've seen shortages of lumber and labor. We have an opportunity to do something because our Republican colleagues, at least some of them, understand the magnitude of this problem for their constituents. And so the normal thing to do in a functioning legislative body where the President of the United States does not believe that he is an elected monarch is to try to negotiate some accommodation. After all, these are all of our constituents. It's not like they're exclusively in urban areas or something. They're not exclusively Democrats. In fact, they're slightly more Republican than Democrat on the ACA exchange. And so if this were a normal, functioning time in American-style democracy, the President of the United States would convene what they call the four corners: Majority and Minority Leader of the Senate, Speaker and Minority Leader of the House, and we'd try to figure out whether there was an accommodation to be made to save our collective constituents from all this pain. There is still a pathway, but it has to be pursued. And so the onus is on the President of the United States and the Majority Leader and the Speaker to find that pathway.